The studies have shown that between 40 and 70, we can save lives if we can find breast cancers early.
So the incidence of aggressive thyroid cancer is the same in men and women, and the incidence in autopsy studies is the same, but women do seem to have more of these low-risk cancers.
Of course, when we're thinking about cancers of female reproductive organs, we're largely thinking about endometrial cancer, ovarian cancer, cervical cancer, vulvovaginal cancer.
How much personalized breast cancer has become.
Access, quality of life, mitigating the surgical burden, how to maintain somebody's optimal quality of life.
My favorite thing is to tell somebody that they don't need surgery. Not all cancer needs the surgery, not all nodules need surgery, but many of them do. But where the field has come in years is the less is more approach.
We built a breast health clinic so that patients can actually have a direct access to a breast specialist, usually within 24 to 48 hours, right in our clinic. And that way we can alleviate all of that anxiety. If you feel something, come in, we can look at it, we can assess whether or not you need imaging. If imaging is needed, we can get that done very quickly and answer that question.
Like the field of breast cancer is probably one of the most advanced fields of oncology today.
At age 65, what I always stress to the patients is that it doesn't mean that you can stop getting pelvic examination.
So even if you do need surgery, if we can save half of your thyroid, we try to do that. Now, obviously, more involved cancers, and then the organ needs to come out.
But in general, we have known since probably the 1990s that there's no survival benefit whether you do a small operation or a big operation. So survival is exactly the same whether we save your breast or if we remove the entire breast. And that's really important for people to understand, because I think most people have this misconception that bigger must be better, but it's very much like thyroid. Sometimes less is more.
A full pelvic gynecologic examination requires a full visual inspection of your vulvovaginal region, because you could develop lesions on the vulva area. You could even develop melanoma. Transvaginal ultrasound does not replace your doctor doing a thorough visual inspection.
Genomic tests that can tell us if the patient needs chemo or not. And not everybody needs chemo, not everybody needs the same chemo. And there's so many targeted agents now that are approved for breast cancer. You hear 1 in every 8 women has, at some point in their life has breast cancer. But the statistics that should be contrasted with is that only 1 in 40 dies of breast cancer.
And so just for those of you who may have a few silver hairs and maybe are in that demographic, it is not because we say, after that we expect you to check out. When you get to a certain age of maturity, you've outrun a certain amount of risk, and then you face forward to a different kind of risk. And so we want to modify and individualize at every point in somebody's life, what do they need in terms of their best screening, what is appropriate for them. Sometimes it's an increase in screening, sometimes it's a diminution in screening. It's because they're saying the risk benefit, the likelihood of us being able to find something is equal at this interval as it is at another.
So these so-called smart chemo drugs, you have the chemo drug that is pretty toxic, you link it to a marker that is only found on the cancer cells, and then you infuse this one thing as a whole to the cancer patients, and when the whole drug finds the cancer, only then we say it delivers the payload. So then you have less side effects, you may not have any hair loss, you may have far less nausea with these chemo drugs, and much more targeted.
Thank you for coming out, and we hope you'll be back and learning more. Thank you so much.